Trinity Ashton has congenital heart blockage.
I need to do it again.
She was only 3 years old when a pacemaker was placed in her chest. But then, one of the lead wires that connect the pacemaker to the heart was broken by her vigorous play. She faced having the pacemaker replaced with surgery that would open her chest. Instead, 5-year-old Trinity recently became the first patient in Michigan to receive a new thin heart lead with a catheter delivery system.
Instead of putting in that same old pacemaker, you got a brand new kind, a brand new cord. First, yeah? You're the first one to have
Here
that?
I am famous.
And here you are, famous indeed. And we're very happy to have you here, famous, too.
Dr. Peter Karpowicz performed this minimally invasive procedure. He is the Director of Cardiac Electrophysiology at the DMC's Children's Hospital of Michigan. He showed us the problem with Trinity's heart.
All right, you look at the heart's a pump.
Right.
It has to be run by electricity. If we open up the heart on the inside, the electricity starts up here in the upper part of the heart. It then runs down through the middle of the heart. We're going to open it up the lower part. And then there's essentially an electrical pathway that runs right through the middle of the heart here.
Right.
So that allows the upper part to communicate to the lower part, so you have the classic lub-dub, lub-dub, lub-dub of a normal heartbeat. With congenital heart block, what happens is that the upper part of the heart doesn't communicate to the lower part of the heart. There's an actual gap in that wire.
Right.
And that was the problem with Trinity. So that the lower part was beating on its own at 30, 40 beats a minute. The upper part for a child was beating at about 100 beats a minute. That, over time, causes heart failure.
So rather than have Trinity go through open chest surgery, Dr. Karpowicz opted for the new FDA-approved thin lead catheter delivery system. It requires only a 1.5-inch incision made to look like a skin crease near the patient's armpit. Using a catheter, Dr. Karpowicz slips the new lead into place and attaches it both to the heart and the pacemaker. Now, with the upper and lower parts of her heart communicating and working properly, Trinity's prognosis is good. With the minimally invasive thin lead procedure, there was little pain involved, and Trinity remembers only this.
They took me in a wheelchair and make sure I didn't need it.
Within a few months, Trinity was back to normal.
Lead's working great. She's running around doing stuff that she wants to do, and we're just monitoring the battery. And when the battery drains, as they all will because they're lithium iodide batteries, then we'll make a simple little incision, take out the old can of the pacemaker, put another one in, and be all set.
I had full faith in Dr. Karpowicz. He's been nothing but a compassionate human being who has really, in a lot of ways, explained and made me feel comfortable with what he's doing.
Go down, 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 down!
And Camille has a healthy child who is fairly unlimited in her activities. Visit us at any time at dmc.org to learn more or to make an appointment with Dr. Peter Karpowicz and the fine team at Children's Hospital of Michigan. The DMC. We just think it's a better way to get better. I'm Emery King.